In the news this week, the wife of late actor and comedian Robin Williams spoke out for the first time about what may have driven Williams to suicide. The 63-year-old killed himself last August. An autopsy showed he suffered from a condition called Lewy body dementia, not as well known as Alzheimer's, but the second most common type of dementia. Here to discuss more details is Tacjana Friday, a neurologist at Noran Neurological and Abbott Northwestern. Thank you so much for being here. Okay, let's start with the basics.
Yeah.
What is it? Not a lot of us have heard about this.
Yeah, so you said something important. It is the second most common form of dementia next to Alzheimer's. And so I think it's really important that we talk about what it is. So it is a dementia, meaning change in thinking, that is characterized by deposition of protein, alpha-synuclein proteins all over the brain.
Okay.
And that ultimately results in the things that we see with this condition. It consists of a triad of dementia or a decline in thinking, a change in fluctuations in alertness. It can also result in Parkinsonism symptoms. And what I mean by that is motor changes, so mass facies, so not a lot of expression. And people definitely notice that. A slowness in your gait or your walking, slowness in movements, a tremor. Okay, and it also results in hallucinations, frequently visual hallucinations. And that can be frightening for individuals.
Absolutely.
It's animals, it's deceased individuals. So
those are the most common things to look for?
That is correct. In addition, there are other things, autonomic symptoms, such as poor control or labile blood pressures, bowel and bladder function. That can be something, sweating function. Also, sleep disturbances. Very common with this condition is called REM behavioral disorder. And with that, people act out dreams. They might be punching their significant other in the bed, follow to bed. They actually act out their dreams. So it's a very treatable sleep disorder and a very important one. They can also get sundowning, where they're up at night, sleeping during the day. There can be insomnia. So many different treatable symptoms with this condition, even though it's a progressive condition.
Because it's not preventable, but it is treatable.
That is correct. It is a progressive condition. We don't have a disease-modifying or agent at this time or a cure, but we address the symptoms, and so that's really important.
Is it possible that there's more people out there that have it that don't realize it? Because the symptoms you're talking about, do you get a combo of those? Some of them you might not run to the doctor right away. You know, you're getting older. You was 65 years old. You know, your gait's a little slower. That comes with age. Do you typically see a combo of those symptoms?
We do. That's a really good question, because it is an evolution, and that's often why it is misdiagnosed. It may present with the memory component at first and may therefore get diagnosed with Alzheimer's. But as time goes on, then the other thing, the Parkinsonian symptoms or the hallucinations, or perhaps a different reaction to the treatment we use, which is a little unusual. We say, that's not typical for this type of condition. So it's often an evolution in time, because we don't have a lab test to diagnose it. It's watching them clinically. We can do imaging studies. We can do some testing to try to rule out treatable, for example, thyroid disorders or other conditions that might mimic certain conditions or treat depression if it's there, but we don't have a lab to diagnose this condition.
And it is so challenging to diagnose, but there are treatments, and mainly just medicine prescriptions, right?
If there's depression, antidepressant medication. We do use some of the memory medication to help with the hallucinations, to also with the memory. And then the Parkinsonian symptoms, we do use the same treatment that we would use for Parkinson's disease to help with the motor function.
And I know you came on here, and thank you so much to help bring awareness to this. Do you think, like I said, it's out there more than maybe even doctors realize and the medical community realizes?
I think so, definitely. And it's important to seek medical attention. I think just pay attention to signs that are alarming to you. If they're not sleeping, if they're changing the way they're falling, or they're changing the way they're walking, if they look different, clearly their memory is different. Just seek medical attention. Ask the questions, because it's very important to educate individuals so that they know what to anticipate, and families as well.
And again, most common in older folks?
Yes, definitely.
What age range?
Over 60, male more commonly than female. And so as we age, dementia is more prevalent in general. And then again, like I said, the evolution of this condition often helps us diagnose with this particular condition, the Lewy body dementia.
Well, it makes sense why Robin Williams' wife would be speaking out, because, you know, he was so loved and people were taken aback by his suicide, but hopefully some good can come out of her speaking out about this sensitive topic. So thank you, doctor, so much for sharing your insight.
Welcome.
We appreciate it.
Thank you for having me.